The American College of Radiology.
Focused, forward.
Together.
I'll go ahead and start by introducing myself and my co-host, Caitlin. So I'm Dr. Haberl, a R3 radiology resident at Dell Medical School in Austin. I'm in the first class of residents, and I've been fortunate enough to be at the state capitol. So I've attended Texas Radiology Day at the Capitol and learned about advocacy. And I initially matched into general surgery, but decided to switch into radiology, and I've never looked back. So today I'll be hosting with Caitlin, who has a Bachelor of Science in Human Biology and Society from the University of California in Los Angeles. And she's a rising second-year medical student at Georgetown University Medical School. She looks forward to learning about advocacy, and I will let Caitlin go ahead and introduce our speaker, Sally.
Yep, so one of our speakers is Sally Midani, and she is a second-year diagnostic radiology resident at the University of New Mexico, a former New Mexico Medical Society medical student appointee, and speaker of the medical student section for the American Medical Association. And she will share her journey lobbying with legislators while empowering the trainee voice in policymaking.
Awesome. And our other panelist will be Ashley Walton, who is the Government Affairs Director for the ACR. She has a BA in Political Science from the University of Kansas and a JD from Ohio Northern University. She has nearly 15 years of experience of lobbying and healthcare policy experience. And last but not least, we have Dr. Nilda Maria Williams, who's a body imaging radiologist at UMMC, and she's a member of the ARRS Wellbeing Subcommittee and president of the Mississippi Radiological Society Board. She finds great fulfillment in integrating her enjoyment of practicing and teaching radiology and advocating for and leading physician well-being. And she is a mom to 3 little girls. And she strives to help create systems and cultures that prioritize and support physician well-being so we can all find joy and fulfillment in our personal and professional lives. And we are very grateful to have all 3 panelists here today. And so I will hand it off to Ashley Walton.
Good afternoon or good morning for they're in another time zone. As mentioned, I'm the Government Affairs Director at ACR. What that means is I work in our Government Relations Department as part of our DC office. We advocate to Congress on issues important to radiology. And I've been with the college about 2 years now. And prior to that, I was with the anesthesiologist. So lots of healthcare specialty experience. So just to give you an idea of the current landscape of kind of all the issues impacting the specialty. We do have a Medicare payment system that is not sustainable. We've seen year after year cuts. This is like an underlying issue that really contributes to many different factors in medicine, and especially the physician workforce crisis that we're experiencing now. So before we can address all these other issues, we do need to address Medicare payment. Some of the things I'm going to discuss today do include some short and long-term policy solutions. So I will mention specific pieces of legislation that have been introduced in Congress. So the key issues are physician payment, graduate medical education, appropriate use criteria, and then some other ancillary issues as it relates to residency and training. So to first kind of give you an idea of what's happening with the physician payment system, really, it's failed to keep up with the cost of running practices. We see year-over-year reductions to the Medicare physician fee schedule. This is largely due in part to a requirement called budget neutrality. So if you think about the fee schedule and how it pays all the different areas of medicine, we have one pie, one pot of money, and we're all competing for that same pot. And anytime you give a little bit over here, takes away from over there, and it has to balance itself out. So we really are always competing against all the different areas of medicine. And we are one of the only fee schedules that does not have an inflationary based update. That is one of our key issues that we are trying to get introduced and passed in Congress is an inflationary update to the fee schedule. We've seen Medicare reimbursement decline 29% since 2001. So really just the bottom line is that we need to reform Medicare payment so that, the future of the workforce is sustained. So some background on the fee schedule, really since about 2020, 2020, Congress has been able to mitigate some of our statutorily required cuts. So what this means is that through legislation, they apply a positive adjustment to the conversion factor, which is the starting point for calculating Medicare payment. So how did we get here? I did mention these budget neutrality requirements. Well, on top of that, in 2019, CMS had finalized for implementation a code that would virtually be an add-on code for evaluation and management codes. Now, what this means is really it's for patient-facing physicians to bill. So there are other specialties, including radiology, that this really does not benefit. So we are really concerned with the implementation of this code. And then on top of that, another code that was supposed to come online at the same time in conjunction with the E&M codes is this code for complex care. So back in 2021, the conversion factor was set to be, minus 10%. Now that is a huge hit to the specialty. So in response, the ACR did form a coalition with the medical community, so both physicians and non-physician providers, and we've been all working together since early 2020 to advocate in front of Congress really that they need to address these cuts to the fee schedule. So moving on, we have seen some short-term payment reform. Congress added 3.75% to the conversion factor for 2021 and did delay the G code for 3 years, which was helpful because the planned reductions did not go into effect at that time. They've continued to legislatively increase the conversion factor, so both for 2022, 2023, and 2024. But then all these cuts really did come online that I mentioned earlier because of the G code did start in 2024. So this year was a little bit of a wonky year in that the political dynamics were not the usual year-end healthcare package where Congress tends to do these plus-ups to the conversion factor. Things were delayed. We had multiple continuing resolutions. So really Congress was trying to fund the government and they just kind of kept kicking that can down the road. So in the March 8th appropriations package, this is where we saw the changes to the conversion factor. They struck down that 1.25% and replaced it with an additional 2.93%. So we are pleased to see this, but again, it was still a cut to the conversion factor. And me talking about all these issues is very timely. Each summer, CMS puts out their proposed rule for the fee schedule, and that just happened yesterday. So this is for next year's payment, the 2025 conversion factor, and it's actually pretty positive. The ACR economics team is looking to analyze the rule in its entirety still, but we're largely pretty pleased with how it's looking. So it's very timely. But we do still have our coalition that we work with within the medical community advocating on these issues in front of Congress because long-term payment reform is necessary. So there is a bill to address that inflationary update I mentioned earlier. It is known as the Strengthening Medicare for Patients and Providers Act. It was introduced by several physicians serving in Congress, has the support of largely the whole community, and we think our only barrier really is the large cost it would really entail to enact such legislation. But we're pleased that, we at least have something out there that would provide for an inflationary update to the fee schedule. So a really big issue impacting the workforce really are the shortages that many specialties are facing. Medical and school enrollment continues to grow, but the training does not keep pace. There has been an artificial cap on graduate medical education slots since 1997. But there were a few wins in recent years. So some exceptions to that cap, really just incremental increases to the number of GME slots. through the Consolidated Appropriations Act, both in 2021 and 2023. So we've seen Congress add 1,200 new slots total as part of legislation. So these are big wins. I mean, really, hospitals have to apply for them on behalf of their program, and then CMS is actually in charge of distributing them. So there is a very complex process to the distribution of the slots, but there is still legislation in Congress that would provide for more slots. So both introduced in the House and the Senate, we have our House Bill 2389 and our Senate Bill 1302. It's the Resident Physician Shortage Reduction Act. This would increase the number of slots by 14,000 over 7 years. So that's a pretty big increase, but also, again, a hurdle is the cost that it would entail to enact such legislation. So as you can probably tell from what I'm saying, like anytime Congress has to enact legislation, there is always the question of how much is this going to cost and how can we pay for it? So they're always trying to look for, where they're spending other places that they can offset or, take a cut, ways to pay for these things. So another workforce issue really impacting the barriers to our international medical graduates training or working in the U.S. is after they do their training here, they're typically on a J-1 visa. Now that requires them to return to their home country before they can stay here on a more permanent visa or a work visa or a green card. There has been a program since the 90s known as Conrad 30, and this allows each state to kind of wave through that process, 30 per state. So those international medical students do not have to return to their home countries. They're able to stay here and work in the US in exchange for working in an underserved area for 3 years. So this is legislation, ongoing program. It just has to be reauthorized. And these bills would reauthorize that program for future years and actually increase the number of waivers from 30 up to 45. So another issue impacting whether or not folks abroad can come work in the US is the visa authorization process. We have folks approved to come here, physicians that are ready to serve American patients, but due to backlogs and other complications with visas, they're not able to get here. So legislation to address this problem is known as the Healthcare Workforce Resilience Act, and it would recapture essentially unused visas that the US has. So both for physicians and nurses. Because of the overall burden on the workforce as it relates to workload and the additional ordering of tests, the ACR has been trying to get a program known as AUC or Appropriate Use Criteria in place since 2014. It was passed as part of larger legislation known as PAMA. We've reached a hurdle through the implementation process with the agency. So CMS is unable to verify the adherence to the AUC consulting by the ordering provider. So we are proposing, in order for the agency to overcome this hurdle, that instead of using a real-time claim processing mechanism, that really the agency could use an audit process, and that would enable them to verify that ordering physicians have consulted appropriate use criteria. So this will address the workforce issues through, managing wait times, kind of relieving some of that backlog so that radiologists are only interpreting necessary imaging tests. So we have been working with Congress to ensure that a technical change is made to the ongoing program that would enable the agency to implement the AUC program. That's already part of law. So just to touch briefly on a few other bills that I think would be of interest to this audience, we have the READY Act, the SPARK Act, and then a rule bill that is actually part of an ongoing program in Congress. So you might have been familiar with the READY Act as it's been introduced probably the last 3 years that I can remember in Congress. And really it would address the student loan issue, provide interest-free deferment on student loans while students are in internships or residency programs. So really just deferring those loan payments and stop that interest from accruing while they're still in their training. and there are both House and Senate bills currently in play. The SPARK Act, or the Specialty Physicians Advancing Rural Care Act. We love acronyms in our world, so you'll notice that as well. This really looks at supporting specialty medical care in rural areas and really provides funding as part of HRSA, one of the agency's grant programs that would really support specialty care in these rural areas. And then to talk about the Rural Residency Planning and Development Pilot Program, this has been enabled since 2019, but the bill that's been introduced in the House would actually reauthorize and dedicate a funding stream permanently for these programs, which would cover startup costs and really just the sustainability of rural residency programs. So these are kind of highlighting all the things I just talked about. I won't repeat them because my voice is starting to go, so I apologize. But I'm really looking forward to taking questions at the end of this. So I will turn it over to one of my colleagues here, and thank you so much.
Thank you, Ashley. Those are all really important bills, and it's good to know what's going on behind the scenes. For those of us that aren't aware of what's happening in Congress and the House and the Senate. So we will now go over to Sally, who's going to talk about her experience with advocacy.
Thank you so much, Ashley and Betsy. That was a really great overview of some of the issues that we've been advocating for in the last few years. I am really here just to zoom out and give you all a perspective from a trainee, having been involved in advocacy since I was a medical student. Just to give a quick blurb on what the ACR is, there are over 40,000 radiologists, radiation oncologists, interventional radiologists, nuclear medicine physicians, and medical physicists. And trainees actually comprise over 11,000 of those individuals. We have hundreds of amazing, amazing staff that are working tirelessly to push forward the policy and advocacy initiatives that are a priority for radiology, radiation oncology, and tons of volunteers and chapters that make up a really, really strong organized medicine organization. So knowing that radiologists and radiologist hopefuls love images, I really think that I think about organized medicine in a certain philosophy. It's definitely not a one size fits all, but I think about it kind of like an onion in the sense that it may not be, the most appealing vegetable on the block, but I do think that when you cut it open, there's a lot of layers to it. It adds a lot, especially to your medical training, your experience as a growing physician in your career. And so while I think, a lot of it can be daunting because there are so many layers to it, hopefully, some of the tips and takeaways that I've had during my time in organized medicine can make it so that when you cut into that onion, there's no need to cry. So if we were together in person, I would really want this to be more interactive and just hear a little bit about your stories and the reasons that, you're tuning in here. If you've made it this far, you're listening, you're joining in as a participant, then there probably is something that you are passionate about that brings you to the table when it comes to advocating for patients or advocating for the issues that matter to you. For me personally, I grew up in New Mexico, which is a very underserved state overall. It was definitely a cornerstone of my medical education to prioritize social determinants of health and to think about patients in more of a holistic sense. And so that really shaped the framework of how I think about advocacy and really started to brew this kind of frustration within me. I wanted to do more to help. And while I definitely prioritized and wanted to, further myself as a future physician in the sense of, studying, taking tests and doing all those things, I also felt like there was more that I could be doing in medical school. And that's ultimately what led me to participating more in advocacy. So my general approach, which this definitely is not like a 100% success rate, but takeaways that I've had, number one would be to identify an opportunity or a mentor. If there is someone who, looks you in the eye and says, I see something in you, I want to take you to this conference, or I want you to join me on this project, I think that that can be one of the most powerful steps in the direction of working on some type of advocacy initiative. even simpler than that. If you receive an email in your inbox and it says to apply for a deadline to, whether it's submitting a policy item or volunteering to serve on a committee, those types of things, really just like taking those few minutes to submit it and see what happens can definitely open the door to something that you may not expect. Number two would be to explore the lay of the land. During my time working in advocacy and policy work, I discovered that I had more of a knack for governance and learning about how organizations function. And then I realized that just how powerful that can be to not just physicians who are members of these organizations, but medical students, residents, trainees. So understanding the mechanisms of how an organization functions can be very powerful for you being able to accomplish whatever it is that you want to, for you being able to push forward whatever your priority is. Then you definitely can't discount the in-person experience. My first experience was attending an advocacy conference for the American Medical Association in Washington, D.C. as a first-year medical student and advocating for different iterations of some of the bills that Ashley was discussing. And that definitely hooked me because I felt like I was not only learning and growing in a way that felt very fulfilling, but I was actually able to take action as a trainee and, have a seat at the table. Investing in some type of project that kind of ties into number one. But if you're able to find something that you can join in on, if a senior member in your medical school or in your residency program is trying to put forward an initiative, I think that can be really rewarding because then you have a stake in whatever that project may be, whatever the initiative is. And then lastly, I would say don't be afraid to say yes. That's what the caveat of knowing kind of your limits and your boundaries. You can definitely say yes too much, but I think that more times than not, when I've said yes, I have not regretted it. And just a little bit about me and my background. So I am a daughter of two immigrants from Syria, and that definitely shaped my lens and how I view the world, humanitarian issues. And there was an ongoing war there for the last decade plus. And so a lot of my initiatives have been more equity focused because of that background. And so that led me to being involved in organizations like Physicians for Human Rights in my local chapter, establishing an asylum care clinic, and then participating in other organizations like the New Mexico Medical Society, testifying at the state legislature on things like the Medical Malpractice Act for, having a little bit of an interest in medical legal issues. And then a peer mentor really brought me into the American Medical Association, which has been definitely a whirlwind experience. Have lobbied in Washington, authored over a dozen resolutions that have passed the House of Delegates that are definitely more health equity focused, and then ultimately served as the speaker for the medical student section, which was really the most inspiring thing that I did in medical school. I feel like I was able to connect and help take people in directions that they didn't know where their path was, and so that I think was really amazing. And then now in the ACR, serving as the AMA advocacy liaison. So really, this is just to kind of say I've done a little bit of a sampler of different things, and so it's not a one size fits all. And things may change over time. You may be interested in a different organization. You may be interested in a different type of advocacy work, and that's totally fine. Things evolve and change over time, and the way that those opportunities arise is also very diverse. So really just taking it back to your story, I think for me, I've touched on this, but the thing that makes me continue to show up are my own values and the things that are core to me. And I feel like if you can implement those and remind yourself of those, then you will show up, a happier, more energized, motivated medical student, resident, and physician in the future. So those are kind of my tips and recommendations. And I think at this point, I pass it on to Dr. Williams.
Sally, you've done so much work already and you're only, in R2. I think it just goes to show you can start at any level getting involved. So I really appreciate all you've done so far, and that is a really, I think, inspiring for residents and medical students on this webinar. Now we have Dr. Williams.
So I'm going to share my story. So I was talking about her story, and we're going to go over how kind of what I've done in the advocacy space over the past 10 years. It's hard to believe it's been 10 years since I was an R1. And I just commend anybody who's here or watching who's a medical student or a resident. It speaks volumes of you already, and I have a passion in this space. So going back to when I was a resident, this is me and my husband, Henry Williams. He's an IR physician. And this is us at our first ACR meeting. He ran for ACR. They have the different sections, in the ACR. So in the resident fellow section, he ran to be on the nominating committee. He got that. And I've kind of just really been in the background. I haven't, in residency, I didn't run for leadership positions, but I definitely networked a lot when I was there. Met people like Dr. Amy Patel, who was on the ACR office board and is now like Mrs. Radiology, Mrs. Dr. Radiology in the advocacy space. She's the chair of the RAND board. You'll figure out and go into these meetings that the radiology world is small. And these people might be, future employers. You might need them to write letters of recommendation and things like that. So, and also as a resident, I would attend every Mississippi State Radiological Society meeting, mainly for the free steaks. But I learned a lot in going to these meetings about the kind of work that the ACR does. They would present on what the issues were that they advocated for on Capitol Hill Day. So you just learn a lot from going to those meetings. It's also another chance to network with radiologists throughout the state who are in private practice or in academics. So in my first year as faculty, Sally has her many passions that stem from her parents being immigrants from Syria. I didn't really have a passion yet. I wasn't like looking for a passion, but I was just saying yes to opportunities. Like in the well-being space, we're always need to have boundaries, like say no, but I just always like to always encourage the trainees, early faculty to go ahead and explore different opportunities until you figure out what it is that you are passionate about. You can always then go back and say, okay, I'm done now with this role, pass it on to somebody else. But I ended up enjoying these roles that I took on: community outreach coordinator, quality safety officer for our department, a lot more than I thought that I would. And they ended up tying into the later work that I would end up doing. And I just want to encourage everybody to answer any of the calls to action that you may see that come out from the ACR RAN. These are where you can just go to the website, you put in your email address and your zip code, and it takes like 3 clicks, like 30 seconds. I've literally timed it, and so I can tell people through email and through Twitter, like how long it would take you to send letters. What it does is it sends like emails or text, or it can post on Twitter to let your representatives know, where you stand on these issues. So then in my second and third years as faculty, I attended the ACR YPS section of the ACR meetings, young and early career professionals section. And, of course, I went to Capitol Hill Day. And so at the ACR meeting, this top left photo is from the bar of the hotel where the meeting happens. And tell y'all, a lot of important stuff happens here, a lot of networking. I'm sure some jobs end up arising from, this opportunity of networking at the meeting. But here at this table is Jacob Ornsby, who is now the chair of the Young and Early Career Professionals section. At that time, he was not, but he was the Brad Pack liaison for the YPS section. And he later reached out to me and asked me, at that point, I had gotten passionate in the well-being space. I, in my department, advocated for a wellness officer position. And within about 6 months, I advocated for our hospital to start a physician well-being committee, which I have been the chair of for the past 3 years. So he knew, everybody knew, anybody who meets me knows that it's something I'm passionate about. And so he figured out at that meeting and asked me if I would write an article for the ACR YPS newsletter. And so I wrote this article and I shared it in the Rad Chicks Facebook group. And then you'll see later how this kind of came into play. So just opportunities arose from going to this meeting in all kinds of ways. So at the meeting, there were a few lectures on well-being, and I thought, like, I want to be up here presenting, this. Like, I want to talk about this. I'm passionate about this. All right. So now you get to just within the past 2 years, as I said, I had shared that Why Wellness Matters article that I'd written in the Rad Chicks Facebook group. And then Melissa Joins, a breast imaging radiologist from UCSD, saw it and reached out to me that the ARS was having an inaugural wellness summit in Hawaii, and asked me if I would like to attend and be a panelist. And of course, I was like, oh my gosh, yes, please, I would love to. And through that, again, a lot of networking, and then just even more opportunities arose. And then just being in that space, how did y'all end up reaching out to me? I think as part of being on the RAN board, Fatima reached out to me to see if I would present at the ACR RFS section, which for me has been like my crowning moment in my career, because I always say that the ACR RFS section meeting that I went to, back when I was a resident, was like my favorite conference that I've been to. Just learned so much stuff about radiology and the future of our field, and met a lot of people. Richard Dusak, who's the big name in radiology, had presented there at the ACR RFS section, on this stage. And little did I know then that he would be our now chair at UMFC, coming from Emory. So, and also just want to say, so I ran for the ACR YPS RadPAC liaison position. So I had seen some tweets going out from Dr. Amy Patel, encouraging people to run, and I actually hadn't had any leadership positions at that point, but I thought just, why not, not in that space. And so, I put my name out there and I ran, and I didn't get it, but she reached out to me and asked for me if I would be a member on the ACR RAN board as a member at large. So, even though I ran and I did get the position, and somebody got it who deserved it, who'd been in the advocacy space, much more active than I have. But then another opportunity arose. And as a member of the RAN board, I've just tried to help with getting the calls to action out to my department. I've risen to the ranks of now being the president of our state's Radiological Society. So I, email our state radiologists about the calls to action also, and try to get everybody involved and educated on what's going on. From what y'all have heard from, I actually explained everything really well. And I was, I don't understand all of this very, very well. So this is why we support RAN and RadPAC, because there are people like Ashley who know all the terms and everything, but the legislators, our congressmen, our representatives, they need to hear from us. They need to hear from the radiologists, the physicians, because as much as we don't understand what they're doing, they don't understand what we're doing, and we can give them the context of why breast screening matters, why CT colonography screening matters, why low dose lung CTs are important. And so I give this quote anytime I give a presentation on wellness or anything. If you don't have a seat at the table, you're probably on the menu. So it's important that we have a voice, that we speak up, and that we get involved. So in the physician wellbeing space, as I said, I chair our hospital's physician wellbeing committee. The major drivers around for physicians is that we have not enough physicians and an ever increasing number of exams, a lot of inappropriate exams. And meanwhile, while we're being demanded to do more with less, our reimbursement is getting decreased for physicians. So this is what they call moral injury, where you're demanded to do things without having the resources to do it. And so there are lots of different things that, Ashley mentioned earlier that the RAN that ACR and RAN are doing for speaking up for us on behalf of our well-being, to make sure that we get reimbursed appropriately as physicians, to try and decrease the number of inappropriate exams, and just to support physician well-being. So the ACR has signed with other organizations in support of the Law and Order Healthcare Provider Protection Act, which provides millions of dollars in funding to hospitals to support the well-being of physicians and other healthcare providers. So our hospital, for example, we have a suicide screening and prevention program, and there are just lots of different programs like that all around the country, thanks to this act. To improve physician reimbursement, actually went into that a lot. But if it was not for what the RAN has been doing and what we as physicians have been, speaking for, our cuts in reimbursement would be significantly greater. So it's really important that we continue to have a voice and be a voice in that space, because if we're not advocating for ourselves, nobody else will. And then actually also mentioned the different ways that we're advocating for increasing the number of residency spots, making it easier for our core medical graduates, going and expedite the visa process so that they can go and start practicing here. There are some that are stuck overseas that are unable to get over and start practicing. So they're just on Capitol Hill Day, these were the issues that we were speaking about. The different bills that are in the works, going through government and all, trying to get those things passed so that we can have more physicians to help support us if we have this physician shortage. And then to decrease the number of unnecessary exams, again, we talked about the appropriate use criteria and trying to get that back rolling and into action. So to decrease the number of inappropriate exams, increase the number of unnecessary exams. And then in our state, we had a bill that was going through that would have increased the scope of practice, independent practice for our mid-level providers. And I emailed our radiologists and statewide and said, everybody, please, email a message your legislators, let them know that this is where we stand on this issue. And then we were able to stop it. So we're one of the few states that has really kept the scope of practice, the independent practice of our mid-level providers down, which people have different opinions about that. But there are studies out there that show that they increase the number of unnecessary exams and can increase the cost of healthcare. And some wins that we've had, when I was a resident, we were advocating for the USPSTF had recently increased the age for breast cancer screening, and we were advocating for them to go back and decrease the age for breast cancer screening because we were going to be missing a lot of breast cancers if we didn't. And then since then, the recommendations have changed. And also when I was a resident, we were advocating for Medicare reimbursement for low-dose lung screening CT, and that has since passed. And then now just recently, we have some promising information coming out on CT colonoscopy screening. This was also as of yesterday that might be coming through and getting reimbursed eventually. That was everything. So I just hope everybody will stay involved with the ACR, answer the calls to action, follow them on Twitter or X, and just stay aware of what's going on. If y'all have any questions for any of us, it's our contact information on them. I think that's the latest question and answer. And Caitlin.
Awesome. Thank you, Dr. Williams. Caitlin, did you have any questions for the panelists?
Yeah, so I believe the next ACR Capitol Hill Day is scheduled for May 7th, 2025. So are radiology trainees welcome to advocate on Capitol Hill if they are unable to attend the entire ACR meeting?
I think we can possibly all jump in and help answer that. Yes, if you are available to come even just for that day and participate, which is an amazing opportunity experience, definitely please do come. There are ways that we can advocate for you to be at these meetings or try to create accommodations. So please reach out if you are interested.
And one of my questions, as someone that's been fortunate enough to participate in Texas Radiology Day at the Capitol in my state, and I also applied for and completed the TRS Legislative and Government Relations Fellowship. Where is the best place for trainees to search for these opportunities?
So as we were just talking about, there's the ACR Hill Day. That's part of our annual meeting, but many of the states also have their own state Capitol Hill Day. So really just trying to be involved, and even on your own, you can request a meeting with your member of Congress. More likely than not, you'll be meeting with their staffers, but they're happy to, take phone calls. They'll do, virtual Zoom meetings, even if you can't get up to the Capitol. So I will say there's a lot of flexibility in our post-COVID world that people are willing to meet with their constituents, because that's really who the lawmakers want to hear from, is you all.
I think there's also a follow-up question to that in the chat, if you want to answer that too, Ashley. It's what would the student roles be during ACR Capitol Hill Day, and would we be speaking to Congress or staff?
So typically you are in a group. I think we mentioned you coordinate with your state society for the Hill Day. So frequently we, give you guys materials that kind of have the issues boiled down into a simple format. We have talking points, we have leave behinds. So as part of your group that's going to an individual Hill meeting, often people assign roles, like I'll talk about this issue, you talk about that issue, but in no way will you be on your own. It's great to kind of sit and listen in on one before you actually do one yourself. We have programs where, residents come to DC, and I usually say, feel free to jump in with, any clinical or patient relevance, but I'm happy to do the majority of the talking. And then as you get more comfortable, you can, kind of share your experience and talk about those issues more and more. So it is a group effort.
Another thing, just to piggyback off of that, is many of the staffers are more peer-to-peer with the trainees in kind of like age and stage in life, or maybe even some of the younger physicians. And so that I think helps build a connection in a really strong way that you maybe wouldn't expect as a trainee. And this may just be a function of New Mexico being really small, but I'll run into people that I know who are staffers too. So that may be something that, makes it a little more fun and interesting, that you're kind of like interacting with peers.
Strangely, DC is like that as well. We run into staffers around town sometimes.
Yeah, I agree. There's definitely power in numbers, and just if it's your first time and it seems really intimidating, just observe and be part of the numbers. And usually, a physician that has done this a few times takes the lead, and the more you learn about these issues, the better. And I've really enjoyed it. I've only done in person. I didn't know they could do in Zoom meetings, so that's good to know. And, I think another question I had is, are there scholarships available to residents and medical students to attend the ACR meeting if they're having financial difficulties or, potential state radiological society scholarships?
I can jump in here. This is Melody. I staff the Radiology Advocacy Network. Short answer, yes. Long answer is you have to check with the society. So most of the states that do offer scholarships for the annual meeting is either paid by a particular program or they have some sort of application process. So if you are interested, if you haven't been to an annual meeting, and you want to know more about it, feel free to either reach out to me, reach out to your chapter. If you don't know who sits on your chapter executive board, you can reach out to me and I'll get you in contact. But really start with your chapter, start with your program, especially if you're in a very big program. It might be that there are slots available that nobody's using. It's happened. So if you have any questions, we're here to help you through it.
Thank you, Melody. And also, anybody can apply for a fellowship that also is a way to have a funded trip to Washington, D.C. or your state capital, hopefully. For me, I'm really lucky because I'm here in Austin. So I've enjoyed all the advocacy and visits to the Capitol that have happened so far. And Caitlin, did you have any other questions for our panelists?
It seems like a lot of them have been answered already, but I guess maybe what are the biggest challenges you've encountered in radiology advocacy, and how have you overcome them?
Happy to jump in. I would say it's the repeated issues year after year. And sometimes you might feel like you're not getting anything done because you don't see, that specific bill, past the finish line. But then, incremental change is, I think, a big part of advocacy. And if you can recognize the wins, maybe not what you thought they would be, but like the other pieces that are accomplishments. So one example might be payment, right? Like we tell CMS as an agency every year, what we think about their rule, but CMS doesn't necessarily do what we want. Sometimes Congress unofficially helps us with those things. And the same goes for graduate medical education. We've had the same bill introduced in Congress for 6-7 years and it's never passed, but pieces of that legislation have made it into other packages, modeled off of that legislation that's allowed us to get those additional GME slots. So I think the challenge really is feeling like the same thing every year, nothing happens, but you just have to step back and be like, actually, that's not really the full picture.
Definitely. These things take time and, repeated efforts via calls to action, a Capitol Hill Day once a year, plus advocating at your state level. And I definitely think that any small win is a big win. And these bigger bills just take time for us to really advocate for or against. And hearing about wins at the state level is pretty neat too, because that's important as well. Just to at least get, if you're for or against something in your state, you can make a difference there too. And that reminded me about Dr. Williams's win. And I wanted to ask Dr. Williams, what advice would you give to, a young medical student, resident, or attending that is looking to start getting involved with advocacy, but maybe nervous to say yes?
Yeah, so just start, put yourself out there. Like you said, if you see that they're asking for people to run for positions, just, run and give it a shot. Attend the meetings, meet people, network, and then as you get to know people and meet people, you might learn of other opportunities to get involved. So just like get your foot in the door, and then the opportunities will present themselves and keep expanding much more than you realize. So just say yes.
I like it. That's how I met you, actually, is at the ACR meeting this year, and I won't forget our pink and orange jackets matching. So networking is so valuable, and I've really enjoyed attending the ACR meeting 2 years in a row, and I'll be there again this next year. So I encourage all of our attendees and those who watch this webinar to make sure you mark the date and request off early with your program so you can hopefully attend the RFS meeting on the weekend and Capitol Hill Day as well. And the whole meeting if you're able to. We encourage that. But looks like we're nearing the top of the hour, and don't see any other questions in our Q&A. So unless any of our panelists have any other questions or comments, we'll probably start wrapping it up. Well, thank you all. And I feel like this was a very valuable webinar, lots of different perspectives, and a lot of work going on behind the scenes. So I appreciate everything that Melody, Ashley, Nilda, and Sally have done already, and very inspiring to hear you all. Thank you, Caitlin, as well, for co-hosting with me, and I hope everyone has a good day. Thanks for attending.
Thanks,
All right.
Betsy. Thanks, everyone.